Cauti by Madison, Goretti, Marianne, Mache, and Abigail. This is Madison Kenton, and I'm going to be talking about the overview of quality safety measures in organizations. What is a quality dashboard? A quality dashboard is a condition-specific web-based application for quality reporting and population management that is integrated into the electronic health record. It can be used to show the hospital or unit's goals, and it can also be used to help create goals. It will help to improve patient care and quality outcomes as clinicians utilize the reporting tool for population management. What is a quality indicator? A quality indicator is evidence-based and can be used to identify variations in the quality of care provided. How is a dashboard used in nursing at the organizational level and at the unit level? At the unit level, it can be used to compare units, see why one unit's incidence of Cauti may be higher than another, and it can also be used to set goals and learn where a specific problem is occurring within the hospital. Additionally, at an organizational level, it can be used to assess the hospital as a whole and then compare one hospital to another. How is data collected? It's collected from data warehouses.
This is Mache Scott, and I'm doing the individual indicator for the Cauti. Analyze the data for the quarter overall. So for the 4 quarters for this hospital, the goal was to have 0 Cautis. This goal was not obtained. From the 1st to 4th quarter, the number of occurrences increased from 2 occurrences to 4. Why are we measuring this indicator? We want to verify variations in the quality of care. Now, providing evidence to support why this indicator should be addressed. Even with clinical guidelines and studies, the Cautis are still on the rise. There are a number of clinical guidelines and studies about hospital-acquired catheter-associated urinary tract infections, but the rate of Cauti occurrence is still rising. Hospitals are focusing on preventing hospital-acquired Cauti as the Centers for Medicare and Medicaid Services are not providing payment anymore. I found this interesting that staffing and education of RNs is also affecting the occurrence of Cautis. There's a higher percent of direct care nurses with an associate's degree in nursing. There are less total nursing hours per patient day and lower percent of direct care RNs with specialty nursing certifications. This was all related to the Cauti occurrences. Are CMS measures and reimbursement an issue, and why? This is an issue. It is costing hospitals money because insurance is not reimbursing the hospital for acquired conditions such as Cautis. One study found that for the fiscal year of 2017, 769 hospitals had payment reductions totaling $430 million. You can see why this is a concern. Hospitals are losing money based on hospital-acquired conditions. So this affects the economy for the hospitals.
The slide that I will be discussing today is addressing the deficits. The first question is, discuss 5 evidence-based practice interventions to address the indicator on the dashboard. The 5 interventions that I found from the journal titled Enhancing Nurses' Knowledge on Catheter-Associated Urinary Tract Infection Prevention. The first intervention that this journal stated is limiting the use of catheters by ensuring appropriate use. Hospitals can significantly reduce the amount of catheters used if they are properly used the first time around. This means healthcare personnel such as RNs and CNAs are responsible for ensuring catheter and peritoneal care. The measures can reduce the continuation of catheters in patients that did not need them initially, and as well as reduce the amount of time they are used for current patients. The second intervention is use aseptic technique when inserting and maintaining catheters. This is a very important step when providing catheter care. When performed properly, the risk for infections is reduced significantly, which in turn develops a better outcome for the patient and the hospital's Cauti rates. The third intervention is maintain a closed drainage system, unobstructed urine flow, and ensuring only trained persons insert catheters. This is also a key intervention to preventing infection. These are all portal entries for bacteria. However, if maintained properly, the risk of Cauti can decrease. The fourth intervention is strict adherence to hand hygiene and antimicrobial use. Hand hygiene and antimicrobial is an essential skill when providing catheter and peritoneal care. Hands can harbor and transmit bacteria from patient to patient. Hand hygiene should be used at all times to promote and secure patients and staff safety. The fifth intervention is limited use duration of catheters use in all patients, especially those with higher Cauti rates such as women, the elderly, and the immunocompromised. Catheters should only be used when absolutely necessary. Women are likely to develop Cauti due to their short urethra. Elderly and immunocompromised people are at risk for Cauti due to their disability to fight off infection and are more likely to die from infection. So the second question on this slide is how can each intervention address the performance measure? According to the dashboard, the actual goal for Cauti did not meet the target goals for each quarter. The interventions mentioned above could address the performance measure by developing a purpose, patient goals, and the use of data to determine the effectiveness and efficiency of each intervention. The outcome and process of each intervention will be able to determine if changes are needed or if the intervention was effective.
This is Abigail Smith doing the slide Informatics and Nursing. There are 4 questions on this slide, and the first one, it discusses the role of informatics and the implication in patient care and outcome. I think one of the biggest implication in patient care and outcomes is that the informatics has helped identify is by documenting. Documenting the Cauti related incidents is definitely a primary way informatics has helped. Question number 2 asks, how can informatics be used? Again, documenting. I think documenting and keeping data on how many incidents of Cauti related the hospital has with UTIs. The third question is, how is data mining relevant to this topic? So data mining is the practice of examining large databases in order to generate new information. So how I think this is relevant to the topic is that it helps the hospitals generate more information and be able to create more interventions to decrease their Cauti rate. The fourth and final question is, in your scenario, what recommendations for the use of informatics would you make? Personally, I would recommend maybe a creation of icons on patients' lists in the electronic health record to identify who has an indwelling catheter. I think that could definitely help the Cauti rates and the use for informatics.
Hi, my name is Ashley Ellswick, and I'm going to be summarizing the main points. What is the role of performance measures? The performance measures are designed to measure systems of care and are derived from clinical or practice guidelines. Data that is defined into specific measurable elements provides an organization with a meter to measure the quality of its care. Accountable care organizations are required to completely and accurately report quality data that are used to calculate and assess their quality performance. In order to be eligible to share in any savings generated based on their care, a care organization or facility must meet the established quality performance standard that corresponds to its performance year. A quality performance benchmark is the performance rate a care organization must achieve to earn the corresponding quality points for each measure. Based on the number of points they received, they are ranked into a percentile. Organizations that demonstrate specific or significant improvement in their quality measure performance will receive a quality improvement reward. Number 2, why is the observing for patients deficit important? Well, performance deficit is an important part in the process that determines whether or not a facility receives a quality improvement reward. Not only does it allow a facility to distinguish what practices are beneficial, but it also allows the organization to improve practice guidelines and quality of care where deficits are made. Number 3, how could using best practices improve the deficit? Well, using best practices could aid in reducing the occurrences of poor practice or complications related to poor practice guidelines. When practice guidelines are monitored or set into place, they can be altered to improve practices or care when deficits are increasing. Best practices are the implementation of the evidence-based practice collected from prior experiences. Number 4, what is the financial implication for hospitals? Well, the implication for hospitals with performance measures is that if they score poorly on their quality performance rating, they won't make any money. These points are based off practice guidelines and how successful they are when implemented. As mentioned above in the role of performance measures, these savings are generated based on their care and based on the organization and if they meet the established quality performance standards that correspond to the performance year. So the financial implication is pretty much based on their quality of treatment to the patients. Thank you.
This is Goretti Onainor, and I'm going to be speaking about the role of the BSN nurse and leadership skills. So the first question is to discuss the role of the BSN prepared nurse in facilitating this change with some recommendations on how change could occur. So first and foremost, Cauti prevention requires improved practices and policies, and this definitely starts with the nurses facilitating those changes. According to the CDC guideline for prevention of catheter-associated urinary tract infections, they emphasize using urinary catheters only as necessary rather than routinely. So it's really important for the nurses to understand when it's the most appropriate time to start catheters on their patients. Also, according to the CDC guideline, an indwelling urinary catheter should not be used for incontinence or to obtain urine for testing or culture in patients who are able to voluntarily void. Appropriate indications for an indwelling catheter include acute urinary retention or bladder outlet obstruction, a measurement for urinary output in critically ill patients, perioperative use for selected procedures such as a urologic surgery, open sacral or perineal wounds in incontinent patients, patients requiring prolonged immobilization, or improved comfort for end-of-life care. Nurses should make sure that appropriate catheter use, proper techniques for urinary catheter insertion, proper techniques for catheter maintenance, quality improvement programs, administrative infrastructure, and surveillance are being followed to decrease the prevalence of Cauti. Proper technique is definitely a make or break in patients developing Cauti, so it's very, very, very important that nurses follow those proper techniques. Also, developing catheter restriction protocols to outline appropriate catheter use is an effective Cauti reduction strategy. Such protocols can serve as a reminder for healthcare providers, suggest alternatives to catheter use, and generate accountability for each catheter placed. Healthcare workers who handle catheters should also be trained on techniques and procedure for urinary catheter insertion, maintenance, and removal, and should receive education about Cauti overall. Related complications and alternatives to indwelling catheters are also something that nurses should work on. So basically, if all these recommendations are strictly followed, there's a good chance that Cauti prevalence in healthcare settings would decrease, or at least that is the hope. The next question is to include the role of the RN in monitoring the impact of change and how information technology could be used for data collection. As far as monitoring the impact of change, RNs can keep count of how many of their patients have and have not contracted Cauti. And with the help of information technology, RNs can document their findings as to which patients have and have not contracted Cauti.